Assalamu alaikum and welcome to my channel. Today the topic we are going to discuss is symptomatic treatment. For example, we have a patient of multiple sclerosis and we give, for example, for flare we give steroids and then we treat with disease modifying therapy. But we have to control the symptoms also. So for symptoms, we will discuss the following symptoms. For example, the patient has spasticity. So we can give baclofen, that is 10 milligram 3 times a day, and the maximum dose is 80 to 180 80 to 120 milligram per day. The side effects can be drowsiness, withdrawal symptoms, and seizures. The other option is tizanidine. We give it in the dose of 2 milligram TDS, and the maximum dose is 36 milligram per day. The side effect can be drowsiness, deranged liver function test, and bradycardia. Other than this, we have the option of gabapentin. Gabapentin is given in the dose of 300 milligram 3 times a day, that is TDS, and the maximum dose is 1800 to 3600 milligram per day. The side effects include drowsiness and water retention. The fourth option is diazepam, that is given in the dose of 2 milligram TDS, and the side effect includes drowsiness and withdrawal symptoms including seizures. The other options are intrathecal baclofen and off-label cannabinoids. So what we have studied till now is for spasticity we can give baclofen 10 milligram TDS, tizanidine 2 milligram TDS, gabapentin 300 milligram TDS, and we can go up to 3600 milligram per day, and diazepam 2 milligram TDS. Other option are intrathecal baclofen and cannabinoids. Now the second symptom is fatigue. So for fatigue we need to see the root cause. For example, the patient has multiple sclerosis. The fatigue can be due to neuromuscular weakness, it can be due to depression, it can be due to sleep disturbances or insomnia, it can be due to generalized lassitude. So first we need to see what is the root cause. If there is a flare, there is some relapse, then we give corticosteroids. If it is due to depression, then we have to treat the depression with antidepressant. In case of insomnia, we have to improve the sleep hygiene and give the hypnotics. Physical activity should be increased, and swimming is really good against this fatigue. The drugs that can be used are amantadine 100 milligram BD, modafinil 10 to 100 to 200 milligram BD, methylphenidate 10 to 20 milligram BD, and armodafinil 150 milligram OD. So what we need to do is, for fatigue, treat the root cause, and I have told you about physical activity, swimming, and some drugs. The third symptom is pain. In case of pain, we have the options of gabapentin, oxcarbamazepine, carbamazepine, tramadol. Then we have other options such as topiramate, lamotrigine, zonisamide, low potency opioids. Gabapentin dose is 1800 milligram per day, and carbamazepine dose is 100 milligram per day, 100 milligram BD, and we can go up to 1600 milligram per day. We should be cautious about the side effect hyponatremia in case of carbamazepine. Then we have oxcarbamazepine, dose is 300 milligram BD, and we can go maximum up to 2400 milligram per day. Tramadol dose is 50 milligram TDS, and maximum it's 400 milligram per day. The side effect includes withdrawal symptoms, and we should avoid giving it with antidepressant as it can cause serotonin syndrome. The other options are topiramate, lamotrigine, zonisamide, and low potency opioids such as codeine, hydroxycodone. If the pain is persistent, we can also try fentanyl transdermal patch. The side effects of opioids include dependency and respiratory depression. Off-label cannabinoids can also be used. So, talking about paroxysmal symptoms such as Hermit symptom or tonic spasm, we have the options of carbamazepine, oxcarbamazepine, gabapentin, and acetazolamide. What are the options? Carbamazepine, oxcarbamazepine, gabapentin, and acetazolamide. For vertigo, we have option of acetazolamide in the dose of 125 to 250 milligram BD or TDS, or ondansetron, that is an antiemetic, 4 to 8 milligram BD. For nocturnal flexor spasm, we can give baclofen or lazanidine. Next, we will talk about the bladder dysfunction, bowel dysfunction, and sexual dysfunction and ambulation. So, in case of bladder dysfunction, if the bladder is overactive or spastic bladder, we need to give anticholinergic so it can relax, and we can give oxybutynin, 5 milligram TDS, or tolterodine. Oxybutynin transdermal patch is also available, that can be used 2 times per week. We also have an option of midabegron, that is a beta 3 adrenergic drug, and it is given in the dose of 25 or 50 milligram ER tablet. So this was for spastic bladder, so that the bladder can relax. In case of denervated bladder, we can try intermittent self-catheterization, and in case of sphincter dyssynergia, terazosin 1 to 5 milligram along with anticholinergic can be given. Bowel dysfunction, for bowel dysfunction, we can give fibers, we can give stool softeners, we can give stimulants such as Sina, or we can give enema, suppository, or digital stimulation can also be done. For sexual dysfunction, the drugs available are sildenafil, vardenafil, tadalafil, alprostadil, and for females we can give antispasmodic medicines for vaginismus, and vaginal lubricants can also be given. For ambulation, we have the option of dalfampridine, that is a potassium channel blocker, but we should be cautious about the side effect of seizures. So if you remember these drugs, then these are not only helpful in case of symptomatic management of multiple sclerosis, but any other disease in which we can have spasticity, then you can give this management. If we have fatigue, then you can try it. Pain, that these drugs work for pain. Then we have bladder dysfunction, bowel dysfunction, and sexual dysfunction and ambulation. So I hope you like the video, and if you like it, then subscribe to our channel and stay tuned.